So I think first, we really are looking at things. When you talk about payers, right? When Tina told me, oh, I want you to do payer management, I'm like, sure. So my first instinct was to look at it from the provider point of view, right? How payers, how we manage payers as a provider in Salesforce. And Salesforce does a great job of kind of actually providing a way for several different groups within the payer management network to really work together, and then also to still work in Salesforce, but maybe in different data models. So I'm kind of going to go through a little bit of all of those, Tina, and then I'm going to bring it back to probably what you originally had hoped I would talk about. So bear with me.
Whatever you share is going to be wonderful because it's really convoluted topic, so it'll be perfect.
Glad. So, of course, this is us, right? We're the Salesforce Healthcare User Group, known as HUG, and we're on YouTube. And then we also have our own website, and then we're on the community pages as well. And oh my God, it's been so long since I have used Google Slides. But so the Healthcare User Group, we do a couple things. We help those who are new to Salesforce in the healthcare industry and how they're using it, and provide learning opportunities, as well as how the technology will solve healthcare challenges. We provide several resources. We had the virtual meetings like we're doing tonight. And of course, we have the success community, which is the Healthcare User Group, and Salesforce Health Cloud. Those are two that are helpful. There's also one I think that's experts that might be out there too, right? If you have a success plan on your Salesforce, you have more opportunities available to you as a premier member. And then of course, YouTube, and we have each other. So try to connect if you can from the people that you meet today. And then our links are down below, keep you informed. This is Tina, and I'll let her give you a little bit more information about herself and introduction again.
Hey, everybody. So Tina Woodall. I just realized I could be truthful and say it's more than 16 years, but I really emotionally don't want to increase that number. So I have been in healthcare for a long time. And in 2017, I did discover Salesforce. I went all in. I love it. And fun fact, I need to update that too, because it's getting an old fun fact. I have a gecko wall addiction, decoration. Actually, it's over there. Jeez, it's backwards. I'm failing that. So obviously, other than being directionally challenged, I'm very happy to be here with you all and to hear what Kathy has to say. Kathy?
Thank you. So I am a little more truthful. I've been in healthcare for over 20 years. I've been in a variety of capacities, everything from higher ed to managing medical practices and working in public health. So I've been a groupie for Salesforce since 2010, since I was introduced. And then I have jumped out of a plane 3 times, yeah. And I actually want to do that again. I was going through my old videotapes to digitize them, and I've got that video out, and I was like, that was too much fun. So definitely want to try that. And I am a little different. I have beach scenes, and I'm more of a coastal, even though I'm in Orlando. So there is that to say. So no geckos for me. And actually, Tina, fun fact, is actually in Orlando too. Not the Southwest, which you would expect with the geckos in the background, but we're actually about 30 minutes from each other. So today we're going to talk about the Health Cloud payer management overview. And we're also going to talk a little bit deeper about utilization management and care plans. So we're going to talk a little bit of both. And then I want you to remember what we talked about if you were here last time. We talked about provider network management, and that kind of lays into payers. So there is a little bit of that coming back just to bring it up briefly. But I wanted you to remember we have those other resources out there for you too from the last meeting. So payer management. So this is our patient member journey overview. And you'll notice that it does kind of track in 2 different colors, so keep eyes on purple and blue. But really, this is sort of the member starts here, right? They want to find an in-network specialist to work with because the patient is trying to find good health care and from somebody who's in-network, so the costs are also reasonable. And then they qualify incoming the patient referral. This is more on the provider side, right? So we have the provider now is looking for the qualifying that patient referral, and then also converting the referral to a patient and providing transitional and chronic care when needed. And then they also schedule appointments, and the provider also submits for pre-auth to the payer. And that's kind of where the payer takes over, right? And the payer, and this is more about patient care. Keep this in mind. There's a variety of ways that we handle payer management in Salesforce, and this is definitely the patient part. This is the intake. So the intake RN reviews the prior care request on the payer side, right? The provider has submitted the request and now it's over with the payer. The payer may or not deny it. If they do deny it, you can submit appeal, and then the appeal is reviewed. And then, of course, the appeal is either accepted or not accepted. So I mean, we've all been maybe in this journey on a smaller scale, maybe for a medication or maybe for an actual procedure, but it does overlap and does start to transition, right, as we're going through the process of how we care for patients and cover those costs. So that's a high-level overview of the journey that a patient takes and how it interacts between the provider and the payer. So Health Cloud Payer Management, right? It's a system that we use for engagement of managing payers and providers networks and associated contracts. The result are improved access to care, patient experience, provider satisfaction rates, and operational efficiency. And key word is associated contracts there, because now you're talking about the member plan that the patient has, group plans that are with the different organizations, and then you also have the actual provider contract with the payer. So there's a couple different things that happen, but all of those things can be taken care of in Salesforce. So first, with the payer, they have different objects that are available to them that make sense. One is intelligent sales, which is really a sales cloud object. And we also have velocity health and insurance that tackles all the provider and payer connections and contracts and the information there. We also have utilization management and claims. This is also helpful when they're selling member plans and how they do that. And then, of course, we have the provider side, right, where they're trying to verify benefits, which also benefits verification is good for the payer as well as for the provider, but and care management, which is, again, making sure the patient goes through the steps that they need to for care, and then the utilization management for the care requests and the pre-authorizations, and then and the claims, filing for payment at the end of the procedure or treatment. So payer management encompasses all of that in my mind. But there is also a more linear version, which I'm looking at Tina's face going, and that's probably what she's referring to before. And we're going to cover that as well. So first, we're going to start off with some data models to kind of get you used to what's in Health Cloud and what's related to payers. So the next thing we do is, this is the intelligent sales, and this is actually a cut down version because it is a very large data model, but it does cover all of the payers, sales agents, the ones who are selling the products and creating referrals and bringing in providers. This will help document all of those transactions. And when they're out in the field, when they're having visits, this is also kind of overlaps into your med tech, so don't go that direction. But it does cover when they're out visiting groups, right, to sell a group product or to sell their payer member plans to different individuals. So they can do it to individuals or groups, and we have pricing on both of those that we'll cover. Oops. I clicked on the actual link. Don't do that. Then the health insurance, right? We're covering the purchasing groups. So when they're providing health insurance to different individuals, and the payer has several different plans that are available, and they're also specific to the group, or they're specific to the individual plans that are with maybe Affordable Care Act or with AARP or a different retirement group, or if it's really over Medicare, as a Medicare Advantage plan. So your plan benefits and your plan benefit detail covers what the coverage is actually the plan is going to cover. So that can vary for individual plans, as well as when the member signs up, their coverage then is going to mimic whatever plan they purchased. But the purchasing group is going to be the group, so either your Medicare group or like AARP does that for state of Florida with United Healthcare. There's also your own employer group, right? They have different plans that are specific. And then, of course, sometimes they do self-insurance. So there's a different way to look at that as well. But there is, we always want to think about it as the plan, right, itself, the name of the plan, and then, of course, the plan benefit. And then the benefit detail, that gets into now, does it require pre-authorization, what the copay is, all that sort of information. And that is the same as what when you're looking at it from a member point of view, you have your coverage benefits and coverage benefit detail. There are codes that are related to these for the different lines of business and the different service lines. Of course, there's still the pre-authorization and pre-authorization detail that we need to keep in mind for when we're doing utilization management and how we're offering to have different procedures completed, but they require different perhaps tests to do first, or an obligation to do physical therapy for 6 months. So all of that comes into play when you're talking about pre-authorizations. As the purchaser, right, that's the person who purchased the account. You still have a connection with the payer, and then there's the claim, the claims and the claim providers and the claim diagnosis and claim line. So this is when they want to get paid, and this connects back to that intelligent payer model, or sorry, the provider network model that Tina was talking about last time. The health insurance or payers will still use that same data model in Salesforce to be able to relate those contracts and to provide benefits back to their members. So it does overlap back to the provider network. And back to next. So while this is care management, and I'm gonna go back to the demo. When I'm in the demo, this will start to all tie together. But so care management is this is actually the patient on top. The account and contact becomes the patient, and then the patient affiliation to the program. So the program is, the care template is, when you're looking at different methodologies and how to care for patients or standards of care, right? There's usually a problem, a significant problem the patient has, whether it's a diabetes or maybe it's just access to get to be able to get to different meetings or doctor's appointments. So we have different ways to set up that care plan template to make it more useful to you or useful to your business. And I don't really know for sure what businesses you're in out there, but I do know that there's, when you're talking about care plans, me as myself, I've created care plans for medication providers when they need different steps that the patient needs to go through to be able to have the medication stepped up and provided to them to be able to keep influencing their care and making sure they have a good outcome. So you do have goals and tasks that are related to those problems that you can set up in that care plan. Or you can also, we also kind of, it's flexible enough that you can make it your own to fit your specific need. So we've also done it where it's a pre-authorization, and we needed it for a bariatrics procedure or a GERD procedure, or maybe it's just for a psychological wellness visit. So there's different ways you can set up the care plan template. And I'm going to show you that as well when we get into the actual demo, to make it specific to what you are trying to, or your business is trying to accomplish. Very flexible, really easy, and it's something that you can hand off not to an administrator, but to a care coordinator to continue to manage going forward, to make the tweaks that they need to as those different care plans or different goals and tasks that are related to that treatment change, to be able to care for them, especially when you're looking at something that's a lifelong disease.
Hey,
So I think that there's some opportunity. Yeah.
I'm sorry. Let me jump in on this one too, really quickly on care management with the problems, goals, and interventions, which is definitely a clinical model. Something else to keep in mind with this, that I find that a lot of times people really just want a checklist, and action plans and document checklists will serve them better than using care plan templates. So I just want to throw that out there, because a lot of times this is very clinically based upon protocols. And then if you're just wanting a checklist, go to action plans and document checklists, because I've seen people struggle with both of them.
I think that's a very true statement, because I've seen both in use. And when we're talking about, there is always that opportunity. For care management, when I think of this, though, I guess maybe a difference too is that it's, this is one thing that Salesforce also tries to share with individuals who are using it, right, or the different business models, is that there's the experience cloud, and taking this to another level, instead of just keeping this internally, but also, which is you're talking about, right, Tina, that you would keep it as a checklist, or making sure that the care provider or the user is just documenting their work. But the true purpose, I think, of a care request and the care programs and the care management is that it's able to be shared with the individual patient, so the patient can also follow along on their own care, which is something that we don't always see or haven't seen in the past, right? If you're like me, 20 years in the system, but you start to see that this is something, I think, that as we're evolving, it's going to be more wanted and needed. And we're going to continue this on the payer side as well, but there is an opportunity to do that. There is, so it does require a case, and you would follow along on the case. And then there's also the case care team and care teams, and we'll show you how to do the setup for that, because that can be a little different. But so the healthcare financial model is also carried over, and we do have that available. So we still have the, we're checking for benefits. We're making sure that they have a pre-authorization. We can file claims, and then we can also make sure we're collecting the funds from the patient for co-pays and all of those things. And then we do have this. This is a little bit more into the benefit verification. So when it does, you do need a third party to access the member benefits typically. So there are a couple things out there that help you access either change management or availability, or you can do it through an API to be able to find out what the benefits are for that particular member. You always want to make sure that you have, and it's coming back, right, that you have the correct member and it's the information is exact. So you want to definitely check that. And then also so you have your out of pocket on all those things will be verified. For utilization management, this is the correct term for Salesforce. Oops, and go back. So this is really more the care requests and pre-authorizations. And then it goes through those steps that we talked about in the journey as far as making sure that they have the steps that the pre-authorization has been approved. And if the authorization hasn't been approved, that the appeal's been filed, and then the appeal also is approved or denied. So going forward, we still have, and this is the claims model. This is new for Salesforce in the past, I want to say, year and a half, to actually be able to file the claims. And again, it does require an external object to be able to complete the claims process. And I'm going to dive a little bit more into the health payer management. So why did they create it, right? This is more the linear look at it a little bit. So this is, we're delivering a trusted member and provider experience as well.
Kathy?
Yeah.
Hey, can we back up a second? Any questions on that section that Kathy just reviewed? There's a lot of great information. There's no questions in the chat. Does anyone have questions or anything on that before she moves over into the next section? Okay, I just want to give a pause and ask and see. So anytime you guys have questions, throw in the chat. I know this is a lot of great information we're covering, but please feel free to throw in questions as needed. Thanks, Kathy. I just thought that was a good point to pause and ask questions.
No, that's good. Yeah, so the data models can be a bit intense, right, sometimes. And when you're looking at them in Salesforce, it's completely different than looking. So I'm going to dive into Salesforce pretty quick to show that what it looks like when we're actually configuring it and putting it all together. So, and my strong suit is not the terminology. So if I ever am too brief or not exact enough, let me know. So this is delivering trusted member and provider experiences while reducing cost. So a big piece of the payer, right, from the payer point of view, is they want to be able to have their member engaged, right, so they continue to purchase their healthcare. And then also they want to make sure the provider is happy so that they continue to work with them, and still while they can reduce the cost, right? So to work together to do that. And it does take all three parts, right? All three groups to be able to do that. Unifying health benefits administration and this is what I've been doing more recently is, right, working with providers of health. They're not the payer, but they sell the payer's product. So working from quote to renewal and making sure that those members are engaged just to be able to purchase and file and answer all their questions that they have when they're going through as a member and for that particular plan. The target market for the payer network management is mid to large healthcare organizations that have a payer component. So that is more about the group health insurance and also the individual sales administration and benefit administration. So they're on the price list, it lists for $125 for individual and $175 for working with groups. And that, of course, is the list price if you wanted to continue to add this on to Health Cloud. And so I'm going to go right into the demo. So let me get out of here. That. And oops, I think I'm actually in the wrong org here. Okay, so this is the example deck that I pulled down, right? I actually went in and requested one for not just payers, but for what was coming out as new. So this gives you this particular deck or org that they provide is actually going to give you a learning Health Cloud learning section, an app. So you have provider, you also have player, you have med tech, and you have pharma. So you can go through and learn each individual one. For those of you who are studying for your Health Cloud exam, this is I think the best way sometimes to learn is to just, as Tiffany has mentioned over and over again, right? Make sure that you get an example org or a Health Cloud org that's specific with all the information in. And she does provide the links at the end of this deck. So one thing to think about too was with the payer, right? This is the payer information and steps to follow. So this will bring you straight into the Charles Green. And Charles Green goes through the patient navigation card. You also have the patient itself, and then the different things that are available through, just like in those data models that I showed you. So if I'm working for a payer and I'm a user, and I wanted to see how the patient was doing and how I can support them, I would be able to see the patient account from here. If I was a provider, I'd also be able to see the patient account from here, so that I'd be able to go through Health Cloud and be able to set this up so that I have all the information that I need to be able to support the patient. In the payer, it's important that they're able to engage with the individual patient or member. So they do have workspaces. You can start digitalizing a digital environment so that you're able to do that. And this is a workspace like a patient community. So this is the back end to be able to develop an experience cloud. With this, you can also layer in your OmniScript. So your OmniScript gives you an option to be able to walk patients through their benefits, help them schedule an appointment, different processes if they're having issues with alcoholism or anxiety. But this comes with the package itself, and they also show you how to set it up. So there's different OmniScripts that are available, and it layers in again. So you have your ability to work with a patient from this side of the Salesforce, and also from the other from this side of Salesforce as a payer or as a healthcare provider, and then also as a payer. And I need to turn off, I think, this one screen. It's a little distracting, so let me put that over there. So the back to the actual org. So
Hey,
with the
Kathy, can we pause for 1 second? We do have 2 questions from Brian in the chat. So one is, are service requests really necessary with utilization management? Seems like it's overkill when you could just add additional case fields. I think that's coming from the fact of not understanding how utilization management works in the context of what requests are.
Yeah,
right.
this is Brian. I guess if you look at the service request object, it seems to just sort of be some additional fields, whereas I would think you would typically use the case to walk through the process steps of like a service request. So I'm just wondering why the secondary object, how do you use that? Is there like a reason why I should be modeling with that object instead of objects?
Right, so it depends on your use case. So most times when you're doing pre-authorization management, I think the objects that are on the data model for that are come into play, because if you're the actual pre-authorization, it happens most times inside of a case. You still have to create a case. You can't not create a case when you're doing the pre-authorization. But the do you want me to show you the model again, or do you want me to show you what it looks like in Salesforce?
Actually,
either way, I'm familiar with it.
Let me jump in. It's the stupid case. When I worked on a project, we ended up calling it the stupid case. So they're, by default, Salesforce has designed this, like care plans are attached to a case. Utilization management is attached to a case. So the case is the anchor, and then they attach everything to it, and you can't get around it. Yeah. It's the way they designed it. So to you, your point, you're like, well, why don't I just use a case, record type utilization management, and just go forth and do? But that's not how they designed it. They're anchoring it all to cases. And then from the case, it's like you have a case, like what appears to be like a useless case. And it's just their data model and how they're structured. And getting around that will cause you lots of problems. And you need to make sure in your configuration for utilization management that your record type for your utilization management needs to match your case record type. And they all need to be the same. Otherwise, it gets really wonky. I hear you. Anyone who's done the configuration is like, why? And it's just the way their Health Cloud data model is.
Okay, that makes sense. I had thought that maybe the reason for the service request object was so you could have multiple service requests within prior auth case or something like that, but it doesn't actually seem to work that way.
You can, if you have a case so think about it this way, and this scenario makes sense. And any Salesforce engineers who are listening to this, they're probably giving a stink eye calling it the useless case or the wonky case. But when you think of a case, if you have from January 1st to January 10th, and then you get authorization from January 1st to January 5th, then on that case, you could do an appeal from the 6th to the 10th, and you can have it still associated with your case. So you can have one case, and then you can have all your subsequent interactions. So like Kathy's showing on her screen, because you may have a plan, you may have had care from January 1st to January 10th. And then for whatever the insurance is saying, no, we're only going to cover days 1 through 5. Okay, you still have your case. And then you have appeals, you have all the different. So in that regards, it actually does make sense. But that's a much more sophisticated use case where a lot of times it's just like one, a case, management. Those are the simpler ones. It really doesn't make sense. But when you get into much more sophisticated ones, it can completely make sense in how that's used. Kathy, any additional thoughts on that?
Yeah, I think that it just depends on whether you're making the case first or not. So in the situation that Tina was just referring to, the case already existed, right? And then we would create the care request. Because as soon as the patient was referred, we would start the case. In this situation, though, the patient already exists, but the individual case is created at the same time, right? That you're creating the care request, not before. In that case, you don't have the stupid case. It is the case. So it just depends on when you're doing what that workflow is and how when it's getting set up. Right, I do think that the depends too on the how advanced or how some service requests are really simple, right? Like I want to have a new medication, and they have to submit something in to be able to say that they are eligible for the medication because they've been on another medication already. Some things are easy when you're doing a pre-authorization, but some things are definitely more complex. And I think the more complex it is, the more that you're going to want to use something that is more laid out like this. I did look through this, and I have to agree with you. I think it's a bit much. Not every situation calls for all the information that they're asking for here.
Well, I think one thing that's throwing me off is if you go to the appeal, like the way they set this up, if you try to do an appeal, it tries to open another case that you then relate back to your original case, but it also contains a service request. So it just seems redundant to me. I would assume you would open a new appeal service request within your existing utilization, your prior auth case. So I don't know. There's some things about this that I think are just making me think they designed it a different way.
You don't have to use this. You can actually deselect and remove a lot of this. You can do that. And then this is a known. I actually logged a case when I was I think at Coastal Cloud, of two of the Salesforce developers going, this makes no sense to me at all.
Okay.
And one configuration was out of the box. They used flows to actually they address this. So it's the way they do their dependencies on this component that is very confusing.
Okay, I thought I was missing something, but I think that answers all my questions. That it's just set up in a confusing way. I should probably just customize it.
Unless you have used it. I mean, have you used this successfully out of the box, Kathy?
No. So we don't typically use. I haven't typically used anything out of the box out of Salesforce. Usually because the use cases are so specific when you're working with your client that you have to accommodate. So it's not, I think, you really have to take the time to see what really works for your client and go through and make the changes. There are things that you can customize more than others, and this is using their individual apps. I've never used them. In fact, I mute them. Through the permission set when I do a permission set group, so that they aren't exposed to the user, because we always have the the work list and the console, and you can mute those in a permission set group so that they're not visible, and really kind of develop your own app that's specific to your user. And I think that the more that we can keep noise away from our users, so that everything's there, they do a great job of providing anything you could possibly need. And then it's really trying to trimming it down to see what's going to be best used for your patient, your use case, for whether you're working with a payer, or you're working with a medical provider, or if you're working with just an organization that kind of sits in the middle, like a home health care agency. you really want to make sure that it's that you're pulling things that are important to them, because they do need most times a little bit of Health Cloud, but they don't always need all of Health Cloud. And it's because they offer the other service opportunity objects, it's usually not so much of an issue. So this is the standard out of the box. Whether this is useful to you or not is again up to you. But the prayer landing page does walk you through all of that, through the care programs, the service providers, and how to book appointments, how to search providers, and then also the intelligent document intelligent document automation, medication management, and I've done this, worked with this in a different, just this alone as part of a Health Cloud implementation. Provider network management we just went through last week, and then of course the utilization management. This is new, the unified health scoring. This is an actual add-on also. There's more fees involved. So to keep that in mind. But as a payer, right, the payer is looking to make sure that they can stay in touch with that patient and provide care for them. They want to see how they're doing on following different treatments, so that they are moving along in their care and keeping them from out of situations that's going to cause more financial impact later if they don't provide good care along the way. So that's one reason why they do use Health Cloud, to be able to do that, and not specifically just pre-authorizations, but also just those digitized digital experiences, care plan, template, care coordination. Let me get back to that.
Hey, Kathy, let me jump in on that one. So Brian also had a follow-up question. It seems like you're recommending using care programs and care plans in conjunction. Can you add more detail as to why?
Correct. So one thing is, when I'm working with typically with building this out, we don't build it out in separate apps. We keep it all in one app, right? Because within caring for the patient, you don't want to have to jump back and forth, I think. So we actually would have, if it was me, I would develop one app. I would make sure that it does have the ability for them to see the whole patient. So they'd still be able to see this, they'd be able to see their cases, everything that's related to them. These are great up here, but this I also don't always find useful, and will also mute these. I'll take these off, and so we're not exposing them for when they are not related to that use case that we're using. So that's important too, I think, that you have to keep that in mind. All care plan templates.
I think,
I'm getting there, Tina, give me time.
Okay.
So when you're working, so when you say, oh, well, how do we work care plans in with pre-authorizations? Again, it goes back to the complexity. If your individual, and Brian, what is your industry? Just help me out there first.
I'm a Health Cloud consultant.
You're a Health Cloud consultant?
Yes, I'm pretty well versed in all this stuff.
What is your primary client?
I have several across the HLS industry. Life sciences, med devices, virtual pharma, all sorts of different things.
Okay, so same as us, right? Tina and I actually work for the same consulting company. She's now internal, I'm still external. We tend to have a variety of use cases. So depending on the use case, we do use the care plan templates to help with pre-authorization, because pre-authorization sometimes can take 2 years. So you want to be able to follow along with the patient depending on how complicated that pre-authorization is, and that's from the provider standpoint. And I don't know if the payer, I haven't worked with the payer that uses the care plan templates on their side to follow along with that, to make sure that that's documented, because typically the provider provides all of that to the payer at one time.
Right. My question, it wasn't about care plans in conjunction with prior auth. You had said in a previous slide that you would use care plans along with care program enrollment. In my experience, care programs seem to sort of only exist to use that consent capture and then, register products and some shipping stuff around a patient. It doesn't seem to contain a whole lot of other stuff. So I was just wondering, in terms of managing a patient, when you've seen a good use case for using both care programs and care plans, because for me, it's always seemed a little bit redundant. I've never seen the consent management feature be particularly useful outside of like an experience.
Are you using the Experience Cloud? Are you actually creating?
I have, but if you aren't using it, it's not a particularly useful feature.
I agree with that. If you're not using and actually exposing that to the patient, there's no point.
Okay.
Yeah, if you're not exposing it to the patient, I mean, that's where I think they ultimately want to go, right? That the patient's involved in updating that and putting their information in and working together, right? And if they're not doing that, then it does kind of make it seem like just an extra step for the user.
Okay, that makes sense. I'm just mining you guys for ideas because some of this stuff isn't super well documented outside of its very specific use cases. So.
No, and it really depends. Yeah, it's so flexible.
Well, to me, the benefit is if you have multiple care plans that roll into a care program. So that would be a use case, whether you expose it or not to the patient or member. If you want to have a care program with someone newly diagnosed with COPD or diabetes or something, and you want to roll them in a care program, and the care program is 3 months of stabilization, you might have a couple of different care plans that roll into that care program. And that might be useful. I haven't seen that used to date at all, but that to me would make a lot of sense since care plans roll into the care program. But as a care program, like you're talking about, just simply enrolling someone, no. But you can use that use case though for grouping of patient population that way and using those two together. But that's a much more sophisticated. That's a much more sophisticated use case there.
Yeah, for sure.
And I think a lot of time that falls over on the HR side, right? That it's probably
HR?
EHR.
Oh,
it's
EHR.
Probably happening over, in the clinical application more so than, because Salesforce lays on top of Salesforce has always said they're not the medical record.
It depends. Right. If you're hospital discharging, no, because you could still have in Health Cloud, you can have a care coordination team following up post-hospital discharge. They need a home. And a lot of times they're on spreadsheets. If they are doing it from ambulatory or population health management, they usually target those populations and do your care plans. And Optum with their OCCP product is a brilliant example of how they do that. And the OCCP product from Optum is 80% Health Cloud, with the configuration being more of the clinical pathways that they use, that they have in there. So you can
behavioral health is another one.
Yeah, behavioral health. So even
though
we're
talking about hospitalization versus working for an individual medical practice, right?
Well, we're talking about care plans and care programs, and we're talking about population health management. So we can say Health Cloud is not an EHR. Well, you're right, it's not an EHR in the hospital walls. But outside of the hospital walls, Health Cloud holds a heck of a lot of health. It can and should in many ways hold clinical data. And then you just integrate it back to the source system, whether it's the ambulatory system or the payer system. But no, Health Cloud does have all, it's meant to be used in that capacity. Or at least I've seen use cases for that. That would be another hour discussing all the different use cases and whether it should or shouldn't. So sorry, but I'm just telling you.
No, that's good because I don't see that. Not for the clients that I'm working with.
Right, but so with Optum and their product OCCP, there's a lot of companies who use them, and they use their managed package, which is built on Health Cloud. Again, it is Health Cloud with their custom flavor to it. And it's all about population management for patients that have been identified at risk. And they look at their EHR data and the claims data, tag patients, and then one way is you bring that into Health Cloud, tag those patients, then for your care coordinators to work, your case management people to work on those patients, reach out, engage, so forth.
A lightweight use case for it I've seen as well as behavioral health. If you've got like a drug rehab clinic, where they need to sign up with a physical therapist who's going to be doing physical activities, and then a behaviorist, something like that. You can have multiple care plans that are assigned to specific care coordinators. And with Tina's idea of using a care program and maybe a flow, that when you enroll into a certain type of program, then you're automatically assigned to a couple of specific care plans with specific care care providers rather than care coordinators, things like that. Good stuff to think about. Thank you.
We completely derailed Kathy.
Yeah, sorry.
Sorry,
no,
Kathy.
That's quite all right. And I think it's a learning point for everybody, right? So, yeah, I do think there's different use cases. And again, it goes back to the flexibility, right? You really have to take what your use cases are and who you're working with, and make it sure that it's using the best of everything we have to offer. So. So this is, again, for those who haven't seen it, this is what a care plan looks like when you're actually after you've created it. And they do give you information on each one, like how far they are along on completing the tasks, and they're completing the goals and the tasks that align with those goals. You can use just tasks, you can use just goals, you can manipulate it so that you're not using a majority of this. You do, though, always have to have a care team member or a care coordinator. So we do tend to not always have it be a specific person if it's works best for you, but have it be actually like an API or some sort of user that is that does have more flexibility instead of just aligning it to one person. So there is some opportunities there, but you just, the only one that you really need to set up and assign a care plan is you need to make sure you have a care coordinator, but the rest is all flexible. So that is the care plan templates, and those are easy to create too. So, and care plan templates are actually created outside of setup, which is why it's an okay thing to have different individuals be in charge of this. It doesn't have to be a Salesforce admin. It gives you more flexibility to be able to utilize your care team to make these more specific and keep them up to date, which is another challenge, right? So you can create a care plan template just by once the template is created, then you can also create the tasks and things that go along with it. You can also clone. So clone from one to another. You can export them and import them through a data loader. They are considered data. So keep that in mind. But this is a simple template, and it does give you an opportunity to create those goals and then create the individual problems and tasks to go along with it. That is care plan template. But so anyways, this is where you would see, as we were talking about earlier, from United Healthcare, wanting to make sure that the patient had the information they needed. And back to the next step really is that we were talking about experience sites and what you could do with those. I think that's important, and that's, I think, really where we can, as consultants, kind of help hospitals get to the next level, or our clients get to the next level to make these more engaging. I know now with health insurance, this is a good opportunity too. If you're selling health insurance, you have an opportunity to use this to help the members find you and also walk through the process of purchasing the insurance and filling in the information about their specific needs for coverage. And then the OmniScript helps you design those individual walkthroughs through the different objects that they have to work with OmniScript. And this is still new to me. I'm still working on learning more about this. So Tina, if you have any extra information here, please share away. I know it's a steep learning curve, and there is quite a bit you can do with OmniScript in OmniStudio.
I can't really add more flavor on that because my learning curve is still steep, but there is Financial Cloud, and Financial Cloud actually is for the insurance industries. If you are selling insurance, Financial Cloud has a whole section, data model, everything developed to that. So even though Health Cloud, you can do it with Health Cloud. If you are you are having a client that is an insurance company, they're selling insurance, even if they're a broker, it's also would be worth your while looking at Financial Cloud and comparing that with the Health Cloud data model and making decisions from that.
Yeah, because some of Financial Cloud is actually in Health Cloud too.
Right.
They tend to overlap a little bit. And so back to, we talked about setting things up, right? Once you import it, bring the information in. So we had talked about care plan templates that sit outside. They don't sit inside a setup. They're actually part of, they have users access and be able to develop that. There is the Health Cloud admin app also, but as far as the payer, they really don't have you access that either. Scheduling providers and booking appointments for the payer. I haven't had a payer actually ever do this on my behalf, but Health Cloud leads you to believe that that is the case. Tina, have you seen that? Or Brian?
Appointments have not been rolled out into Health Cloud successfully to date that I've been aware of, and I talk and ask all over the place.
I've seen inbound appointments work, outbound back to the scheduling system. I have yet to see work.
Correct. Mostly using some third party.
Yeah. Now inbound, you're just talking about if their appointments have been scheduled, and you get that as a record.
Yeah.
Yeah, but actual true scheduling, it's still swivel chair.
Yeah, it doesn't work. They claim it does, and they've updated their health documentation several times to that tune, and still have yet to see it work.
Well, it'll work if you have unlimited data and unlimited resources.
Yes, that is very true.
So they're right to say that. We don't want to say on the Trailblazer community group that we're calling Salesforce a liar. They're not. If you have unlimited pockets, yes, you can make it work.
And Salesforce Scheduler is an add-on, so there is an extra charge per user for this.
Now, I do have a case for Lightning Scheduler, but that's for people who want to, a use case that I'm actually going to use Lightning Scheduler for with Experience Cloud for people who need to schedule consultative visits with pharmacists. But that's when we have it in Salesforce. It's not external scheduling and trying to do scheduling with another scheduling application. But Lightning Scheduler, just like Lightning Scheduler was used with COVID a lot. So there is that. I want to make sure I call out the differences on that.
And there's a Google API. If you are using Gmail or Calendar through Google, you can bring that into Scheduler. But that, again, would be more, I would think, for a broker management or something, not for a provider. Intelligent document automation. So there is some new things there coming out. I think that that's important to keep in mind. Medication management is another large space for payers because they want to always make sure that they have the ability to, when they're going through, to have an authorization and also keep track of what their current and previous medications are, as well as any sort of, so that does let you track that, and then also more information too about if there's anything there where they're having any sort of adverse reactions. So provider network management, we talked about that. I think I have it. That's everything I got. I've been doing, currently, I'm just in a lot of data and updating data these days. So do you have anything else you want to add to the payer management model, Tina or Brian?
That was very comprehensive, Kathy. Thank you. I think you touched on everything. There's so much there, so much there.
There is, and I think that it all depends on which point of view and perspective you're using, but they all tend to overlap and use those data models and the features that are available to us. But definitely customize them. And that's one of the great things about Salesforce, right? It's like Legos, you make it to fit whatever you need to.